Everybody, thank you for having me. It's great to be back. Sorry it's me and not BTS. I want to take some time today to explain the timeline of what's happening with vaccines for our youngest kids, for kids under 5, and what parents and pediatricians and Americans should be expecting in the coming weeks. So as you all know, the FDA is currently working through a rigorous and independent scientific process. As part of that, the FDA's advisory committee, VRBPAC, will be meeting on June 14th and 15th. They will review the data submitted by Pfizer and Moderna for their vaccines, and we expect an FDA decision shortly after the advisory committee meeting. And we look forward to this process playing out. Now, as you all know, because we've been through this many times, the FDA authorization is not the final step in the process. Before vaccinations can begin, CDC must also issue its recommendations. If the FDA authorizes the vaccines, the CDC will have its advisory committee meetings, and ultimately the CDC director will make her recommendations. And we expect the CDC to make its dates for its advisory committee meetings public very, very soon. So let's talk about what we know at this moment. We know that many, many parents are eager to vaccinate their youngest kids. And it's important to do this right. And that's what this process has been all about. So as I talk through the process today, I want to be very clear that I am not here to prejudge the outcome of the process. But the administration is hard at work planning all sorts of scenarios based on whatever the outcome is from the process that's playing out. We've been working very closely with states, with local health departments, with pediatricians, family physicians, other healthcare providers, and pharmacies to get ready. We started with the playbook we've used for rollout of vaccines for other age groups. At the same time, we're building this program to meet the specific needs of this specific age group. We expect that the vast majority of these kids will be vaccinated by their primary care providers. Now, if and when FDA authorizes a vaccine, we'll move from planning to execution. So let me highlight a few things of what that will look like. Now, the good news is we have plenty of supply of both Pfizer and Moderna vaccines to start our vaccination program. And we are going to make 10 million doses available to states, pharmacies, and community health centers and federal entities to order initially. Starting tomorrow, states can begin to place their orders. We have asked states to distribute the initial tranche of doses to their highest priority sites, including those serving the highest risk children and hardest to reach areas. And we've also asked them to prioritize sites that can handle large volumes, such as children's hospitals. We've encouraged states and providers to find ways to ensure that parents have access to these vaccines for their kids outside of normal work hours, because we want to make this as easy as possible for working parents and their families. Now, FDA authorization will allow us to start shipping doses. These doses are specifically formulated for these young kids. These doses will be shipped to thousands of sites across the country. So let me go back and think through the timeline with all of you. VRBPAC meets on June 14th and 15th. We expect FDA to make its decision soon thereafter. Once FDA has authorized, if they have authorized vaccines, we can begin shipping. We expect some of the shipments to start arriving in their destination over that long weekend. Remember, Monday is an important federal holiday, and many doctors' offices may be closed. And we can't ship vaccines until FDA has authorized these vaccines. And vaccinations can't start until CDC has issued its recommendations. So we expect that vaccinations will begin in earnest as early as Tuesday, June 21st, and really roll on throughout that week. Now, it will take some time to ramp up the program and for vaccines to be more widely available. And as doses arrive in places throughout the country, more sites will have vaccines, more appointments will become available. And our expectation is that within weeks, every parent who wants their child to get vaccinated will be able to get an appointment. We will, of course, do our part. We're going to continue monitoring. We're going to ship doses out as fast as possible. We're going to make sure that supply is always meeting demand. And we're going to do everything we can to make it easy for providers and parents alike to get their kids vaccinated. So let me just close with a few words about the bigger picture, about the moment we're in. It's been a long 2 years. This is the last group of Americans who have not yet been eligible to get vaccinated. But as we think about getting ready to vaccinate our youngest kids, it's worth noting how much progress we've made. 2/3 of all Americans are now fully vaccinated. Close to 1/3 of all Americans are boosted. And highly effective treatments are widely available. As a result, when we look across the country, we see cases rising, nearly 100,000 cases a day. And yet we're still seeing death numbers that are substantially about 90% lower than where they were when the president first took office. Now, we know that COVID isn't over. We still have work to do, but we have made tremendous progress. And what we know is that we've got to keep vaccinating, keep reaching people who have not gotten vaccinated, keep making treatments widely available. Because what we believe is that with science, with hard work, and with resources, we can continue to protect the American people from our oldest to our youngest. So thank you, and I'm looking forward to questions.